Hi everyone, this is Ritu Baliya here, an engagement manager at Healthark Insights. So this video is a quick summary or a preview of our last report in the top 10 series, which is the top 10 healthcare market trends of 2022. So in 2022, we tracked across around 150 trends in the entire healthcare ecosystem, and we arrived at our top 10 on basis of two major drivers and factors, which is the overall impact on the future of healthcare, and second is the adoption of these trends by the healthcare stakeholders. So our top 10 trends were basically across three major themes which we witnessed in 2022. The first one is the changing business operating models by the healthcare operators. Second one was the value-based care, and third one was the federal government initiatives. So coming to the first trend, which is the changing business operating models by healthcare stakeholders. So we witnessed that in 2022, a lot of big players were significantly changing their business operating models in terms of three areas. Like there was a lot of vertical integration, there was a lot of diversification, and there was also a lot of new business units that were being emerged. Now, if we look at the new business units or reorganization, we witness that big players such as Centene and Anthem are increasingly reorganizing their business units in a way to have a focus on the whole patient care. So the whole patient care and being focused on that was a key thing which continued in 2022, and this was in a way the response for consumerism. So a lot of rise in consumerism was witnessed, and this increasing consumerism in a way led everyone to focus on whole patient care. So various reorganization of business models so as to focus on the insurance business as well as the allied patient care, which involved the home health care, the primary care, and other such things. Second, if we talk about diversification, we see that a lot of retail players are entering into clinical trial businesses. Like this was pioneered by CVS Health in 2021 when they launched a new business vertical of clinical trial services to provide services such as patient recruitment for clinical trials and for conducting RWE studies. And in 2022, interestingly, Walgreens and Walmart even both individually followed the same suit. So this was kind of increased. They launched their clinical trial services, and retailers moving into this space as a new form of diversification or entering new businesses was witnessed in 2022. Again, if we talk about vertical integration, now if we talk about the top all 5 to 7, the payers and PBMs in the market, be it CVS, be it Anthem, now known as Elevance, the United Health Group, Humana, Centene, everyone have specialized distinct unit in terms of they are now focusing on provider care, they are now focusing on pharmacy, they are now having relationships around penetrating into primary care and home health care apart from their original insurance vertical. So all this focus of entire the whole patient care increasingly evolved in 2022. So the second theme is value-based care. We see that value-based care has now established itself as a distinct space in the entire healthcare ecosystem. The investments are also increasing, like the investments in value-based care almost quadrupled during the pandemic. And this space is, going to reach, the valuations are going to reach around $1 trillion by 2030. There's a lot of emphasis across all the healthcare stakeholders, be it payers, providers, or pharma, to increasingly foray into value-based care services and to focus into value-based care services. Also, earlier we saw that the value-based services were just restricted to simple primary care, but now the value-based services have expanded. They are even seen across specialties like orthopedics, neurology, women's health, and they are going to expand further in future till by 2030. Also, in an alternate boost to value-based care, we see that CMS envisions to shift 100% of Medicare beneficiaries into accountable care organization. Now, in order to do that, this additional 24 million of beneficiaries need to be shifted. But we see a lot of measures and a lot of steps are being taken by CMS on this front, and this in a way will enhance the entire value-based care landscape and will also give a boost to ACOs. We have also seen that ACOs have been an integral part of the US healthcare ecosystem, and they do provide sufficient savings to the federal government, and this shift will greatly change the entire healthcare ecosystem and landscape over the coming years. So the third theme was around initiatives taken by the federal government. One biggest move came in 2022 and was in form of the Inflation Reduction Act, which will allow Medicare to have higher negotiation powers, and this in a way coupled with the prescription drug pricing rebate will, according to CBO estimates, will save government around $200 billion by 2031 directly at the manufacturer's expense. In another move, the Payer Pricing Transparency and Coverage Rules mandate initiated in 2022. It will go on during 2023 and for the next year 2024, and it will be interesting to see how all these things unfold in terms of the compliance and adoption from the healthcare stakeholders, in addition to the desired results which are expected, and to provide a relief to the overall patient. So we hope that you enjoy reading our top 10 series, and all the reports are readily available on our website on the report section. You can download that and you can use it for your future reference or to know more about the healthcare industry and trends and how these trends will unfold in the upcoming future. And these trends, we hope that help our team of experts and our clients to be on the right side of the business decision, and will surely make a good impact into their day-to-day life.